Okay, we're going to be doing the first part of our three-part series. We're going to be, excuse me, my throat is a little dry. We're going to be inserting an NG tube, and here are all my supplies. Looks like I need some water. First thing I'm going to do is I'm going to verify the order. So this order has been verified by the doctor to give this patient an NG tube. I'm going to provide privacy. I'm going to wash my hands, and I'm going to introduce myself to the client. Hello, can you tell me your name? I'm John Smith. Great, John Smith. Can you tell me your name or you just told me your name. Can you tell me your date of birth? 9970. Okay, great. What we're going to be doing today is we are going to be inserting an NG tube. And what that is going to do is that is going to give your stomach a little bit of rest and make you feel a bit better. Ooh, I just coughed something up. That's not good. But before we do that, I wanted to go over a little bit of your history and ask you a few questions. So first I wanted to ask you, do you have a history of a deviated septum? Do you have any allergies? Have you had any recent oral surgeries? Have you had any recent nasal surgeries? No, I haven't. Okay, great. What I'm going to do now is I'm going to take my pen light, and we are just going to have a look at your nose. It looks clear, it looks good. And then I'm going to assess for, make sure his nose is patent. So could I have you go like that on each nostril? Okay, great, it looks good. We're gonna go ahead and use the right nostril for this procedure. I'm also going to have a listen to his lungs to make sure that they are clear. So I've got my stethoscope. So we're gonna take a listen, and lungs are clear, and we are then going to do an abdominal assessment. And I'm going to have him lay down flat. He is in the high Fowler's position right now, but I'm going to have him lay down flat to do this abdominal assessment. So first I'm going to inspect, take a look at his stomach. Everything looks good, but then we're going to go and have a listen to make sure that everything sounds okay to proceed. So I'm listening to Mr. Smith's stomach, and bowel sounds are normoactive. We are now going to palpate to make sure there aren't any masses or tumors or any issues of pain or sensitivity. So I'm going to push down. Does anything hurt? Any discomfort? No, no. Okay, so it looks like he's in good shape to go. His abdomen does look a little bit distended, but he looks okay to go. So now we are going to measure. And I just completed my focused abdominal assessment. I've got my NG tube here. And what we're gonna do is we are going to measure from his nostril to his ear, and then we're gonna measure from his ear to the xiphoid process, and I'm going to leave about an inch or two below, and I'm then going to tape that. So I have that marked. Now that I've had that marked, I'm going to mark the tube at the correct length. Actually, hold on, I got that wrong. I'm gonna go ahead and put on some gloves. Before I do that, I'm gonna use my sanitizer, putting on my gloves. And my patient has, he's back in the high Fowler's position. He has his chuck on. I am going to give him some Kleenex. He's got his cup and his straw. I have here my my glass to measure the gastric contents of from this procedure. So first, what we're gonna do is we are going to go ahead and lubricate about, I'd say about 2 inches. So this is lubricated. Okay, Mr. Smith, we're gonna get ready to insert this NG tube down your nose. And remember, we are establishing a sign if you experience, if you need me to stop at any point, you're just gonna raise your hand, okay? Okay, so we're good to go. I'm going to, in the high Fowler's position, Mr. Smith, I'm gonna ask you to tilt your head back, rest it against the pillow, and I'm gonna insert this NG tube down your nose a couple inches to the back of your throat. So, I'm inserting, good. I'm now gonna bring his head forward, and every time I push this tube down a couple inches, 1 to 2 inches, he's going to swallow. So swallow, 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 swallow. Good. Okay, great. So it's down to where it was taped, xiphoid process. And then I am going to, we're going to verify the correct placement, but before we do that, we are going to aspirate the contents of this to check the pH and to check what the fluid looks like. So I'm going to take my little syringe. I'm at the end here. Let's pretend we're at the end. I'm going to aspirate. Okay, I'm going to put into here, and then we are going to look at it. So I've got my little pH measure here. The pH needs to be 4.0 or less, and this reads about a 3. A little bit of coffee grounds. Looks like we're good. We're not in the lungs. We got back like 30 milliliters, let's say. And so that looks good. I'm then going to confirm placement. And we do that ideally by x-ray. And I'm going to assess for any sort of respiratory distress or issues like that. Now, to go back, what I would do is I would, this would have been taped to his cheek. And as I did this, and we would go and we would use the tape and tape this to his nose. Tape I've got here, but it's not the clear kind that I would use. So we would tape it around, loop it around, tape it to his nose. After I do that and correct placement is verified, I would, before I would do that, I would secure the tube and mark with a permanent marker. So then I'm going to go ahead, I'm going to take off my gloves. I am going to make sure that my patient is comfortable, and I'm going to document. So did you handle that okay? Yes, good. Any pain or discomfort or anything? No. Okay, so that being said, I'm going to document. I'm going to document the time, the date, how my patient tolerated the procedure. My patient tolerated the procedure well without complications. I'm going to also document that it was confirmed by x-ray, the placement. I am going to document what we saw here in the pH being 3 and the consistency and color of what came up. And I would wash my hands, provide for privacy, ask my patient again, Mr. Smith, do you need anything? He's good. And I would come back in a few minutes and check on him. And that concludes part 1 of NG tube insertion.